Welcome to this explainer. Look, as dive professionals, you already know the drill. Reviewing those medical forms is absolutely one of the most critical parts of your job. Well, today, we're going to equip you with a really clear physiological understanding of a rare, but frankly critical condition you might actually see pop up on a student's medical questionnaire. It's called Antisynthetase Syndrome. So think about this. What actually happens when a student's immune system turns against their own lungs and muscles? Just asking that question instantly highlights why this syndrome jeopardizes the two absolute most important physical assets of any diver. I mean, we rely on our lungs for buoyancy and gas exchange, right? And our muscles to fight currents and haul heavy gear. When those are compromised, the underwater environment becomes incredibly hostile, really fast.
All right, let's break the anatomy of this risk down into 5 quick modules. We're going to cover 1, the antisynthetase syndrome threat, 2, lung involvement, which is the biggest risk, 3, immersion pulmonary edema, 4, muscle weakness and medications, and finally, 5, when is diving possible? Let's jump right in. Starting off with section 1, the antisynthetase syndrome threat. We need to set a baseline for exactly what we're dealing with when a prospective student checks that yes box next to immune system disorders.
Here's the core definition we're working from. Antisynthetase syndrome is an immune condition that causes interstitial lung disease, or ILD, muscle weakness known as myositis, joint inflammation, and occasionally even pulmonary hypertension, which is heart involvement. Grasping this is totally vital because it shows how the disease systematically attacks the exact bodily functions you need to survive, let alone thrive, underwater. It's not just one isolated issue, it's a multi-system threat to a diver's whole physiology.
Moving right along to section 2, lung involvement. Without a doubt, this is the biggest risk. When we're evaluating a diver's fitness, compromised pulmonary health is the ultimate red flag for any instructor. We're looking at some pretty devastating impacts from interstitial lung disease. ILD basically means there's active inflammation and scarring inside the lungs, and that leads directly to reduced gas exchange, getting breathless way faster upon exertion, and a massively increased risk of pressure injury. Because of that scarring, a student could struggle to catch their breath on a basic surface swim, and that's before you even add the stress of breathing dense gas through a regulator at depth. This really illustrates the core conflict. On one hand, you've got standard diving stress, the pressure changes and pulmonary circulation stress that literally every diver experiences on every dive. But on the other hand, you have a compromised lung battling reduced oxygen levels, breathlessness, visible fibrosis on a CT scan, and totally abnormal lung function. When you combine standard underwater pressure with lungs already battling fibrosis, you get a highly volatile mix. If a diver has these active symptoms, recreational scuba is definitively, absolutely unsafe. Now, what's really fascinating and scary about Section 3, Immersion Pulmonary Oedema, or IPO, is how the lung and heart involvement exponentially multiply an already terrifying open water emergency. Just look at this dangerous overlap. We've got the standard risk factors for IPO, lung disease, hypertension, strenuous exercise, cold water, and cardiac disease. And they directly mirror the syndrome's natural symptoms. IPO, as you know, is that potentially fatal situation where fluid rapidly fills the lungs when a diver is immersed. The overlap is literally one-to-one. The syndrome's baseline symptoms act as the exact triggers for IPO. So you're looking at a severe compounded risk of fatal fluid buildup the second the student hits the water. Let's move to Section 4, muscle weakness and medications. Let's see how this threat builds past the lungs and directly messes with a diver's physical ability to handle standard gear and rescues. We've got to talk about myositis impairments. Myositis, which is muscle inflammation and weakness, totally impairs swimming ability, emergency response, carrying heavy equipment, and managing currents or rescues. Think about those standard rescue scenarios you run in a rescue diver course, right? Towing an exhausted diver on the surface while giving rescue breaths. Myositis makes those basic, non-negotiable safety requirements practically impossible to pull off. The crucial takeaway is captured perfectly in this quote from the source material. Even mild proximal muscle weakness may become dangerous underwater. Now, proximal weakness means weakness in the muscles closest to the center of the body. We're talking hips, thighs, shoulders, upper arms. You absolutely cannot compromise on core physical strength when dealing with steel tanks, lead weights, and unpredictable ocean currents. A mild impairment on dry land is a massive hazard at 60 feet. And then you have the treatments. It's a total medication catch-22. These patients are often on heavy immunosuppressants. steroids, mycophenolate, Mofil, azathioprine, rituximab. Ironically, the exact drugs used to heal the patient create secondary diving hazards. While immunosuppression isn't always an automatic hard stop, these drugs bring a way higher risk of recurrent infections, lower bone density, and compromised healing. A minor scrape on a wreck or a coral reef, for someone on this medication protocol, that could turn into a massive, lingering medical nightmare. Which brings us to our fifth and final section. When is diving possible? Let's look at the incredibly rare, strict conditions where someone with this might actually get the green light.
To even be considered, a candidate must have very mild disease, absolutely zero lung involvement, perfect pulmonary function tests, good exercise tolerance, stable disease, and dual medical clearance. They must meet every single one of these criteria just to be considered for conservative, easy diving. It makes it abundantly clear that a standard, quick note from a general practitioner, that is never going to be sufficient. They need clearance from their treating rheumatologist and a dedicated diving medicine physician.
We are talking about a really rigorous pipeline of hurdles here. Step 1, full pulmonary function testing. Step 2, high-resolution CT review. Step 3, exercise testing. Step 4, cardiac assessment. And Step 5, diving medicine specialist review. In the UK, that's the UK Diving Medical Committee. Elsewhere, it's consulting with DAN, the Divers Alert Network. This process demands hard, empirical medical data to ensure absolute safety before that student ever steps foot on your dive boat.
Ultimately, if this syndrome has caused any significant lung impairments or exercise limitation on land, can you safely take them underwater? The resounding answer is a hard, non-negotiable no. As instructors, vigilant gatekeeping is your ultimate duty of care. It's about protecting the student from an environment their body is simply no longer equipped to handle, no matter how badly they might want to dive. When you see antisynthetase syndrome on a form, you now know exactly why it's a massive red flag. But it does leave us with a deeper question to ponder. As medical treatments for chronic immune diseases keep advancing, will our definition of fit to dive adapt over time, or will the unforgiving physics of the underwater world always demand absolute physical perfection from our students?